let's go ahead and get started. Hi, my name is Chantel Meek. I'm a professor of practice at Arizona State University and the founding executive director of the Children's Equity Project. And I am thrilled to be with you all today. Welcome for part one of our three-part webinar series on the Early Head Start Childcare Partnerships. In partnership with the Bipartisan Policy Center and Start Early, we're thrilled to kind of get our three organizations together to really start to highlight the partnerships and all of the great work that they're doing across the country. Next slide, please. So we have a star-studded panel here with some really great folks to help us walk through and think through the partnerships. I will be kicking us off with a few slides, just a basic overview of the partnerships, what they do, what they buy, what they look like and why kind of Head Start as the model. My colleague, Dr. Eric Boucher, will spend a little bit of time highlighting some of the work that Early Head Start Childcare Partnerships grantees have been engaged in over the course of the last few years, and especially kind of with an emphasis on during the pandemic and how they've really stepped up during those periods. And then my friends and colleagues, Yvette Sanchez Fuentes, who's the Senior Vice President for National Policy at Start Early, and then Linda Smith, who's the Director of Early Childhood Initiatives at the Bipartisan Policy Center, will engage in a discussion with me where we'll kind of talk through how the partnerships came to be, why the partnerships, and a whole number of thoughts and recommendations across the various levels of government. Next slide, please. So with that, let's jump right in. I'm assuming most of the folks on the call are early childhood people, and so we probably don't need to say this or have this slide, but just in case, research tells us we have decades and decades and decades of neuroscience, of developmental science, of education research that tell us that high quality early education, high quality early experiences are associated with positive outcomes for kids, short-term outcomes, long-term outcomes across development, across academics, across a whole number of domains. But we also know that that's incomplete, right? Kids' academic development or school readiness doesn't just develop in a vacuum, right? We need a whole number of things. Kids need nutritious food and quality healthcare and mental health support and safe and stable housing and, families that are well and healthy and economically secure, right? Babies and young children grow up in the context of their families. And through these kind of strong, secure, warm, responsive relationships, that's where we see the greatest development and kids really thriving and meeting their full potential, right? And so we need kind of a focus, more broadly speaking, on all of the things that kids need to thrive, and kind of moving away from that really narrow focus. Next slide. But the good news, right, is that the US already has a model, right, for developing this whole child approach, kind of the original whole child approach in the United States that's been around for decades and decades, and today is implemented in nearly every zip code in the US, or maybe every zip code in the US. Next slide. And that's Head Start, right? An early Head Start for infants and toddlers. And so here we just highlight, I'm not going to read everything on this slide, but for those of you who aren't familiar, the Head Start program performance standards have a number of, different standards that are in there that, really set a quality standard for Head Start. They include group sizes and ratios that are much smaller and better than the vast majority, if not all, at least equal or better to all state licensing standards for center-based childcare. We know there's mental health supports, there's screenings, developmental, hearing, vision screenings, nutritious meals, job-embedded coaching, consultation, and professional development. And of course, part of what makes Head Start so special, right? It's focused on the family, it's focused on the community, and really ensuring full family wellness and thriving, right? So there's connections and community engagement with a variety of different systems, right, that ensure families have support and connections to things like job training or higher ed if they want to pursue higher ed, or GED if they want to pursue a GED, or housing assistance, and so on and so forth. We also know that a lot of the quality indicators that we think of at the Children's Equity Project as being kind of promoting equity are embedded within the Head Start model, right? So we know there's tribal and migrant seasonal programs that are culturally responsive and sustaining. We know that there's full inclusion of children with disabilities that predates IDEA. We know that there are standards in there for children who are dual language learners that require exposure of the home language, require bilingual staff if certain thresholds are met. We know that there's infant and early childhood mental health consultation that's required as part of Head Start operations. And we also know that there's limits on suspensions and prohibitions on expulsions, which we know disproportionately impacts Black children, boys, and children with disabilities. Next slide, please. So what does the research say about this particular kind of whole child approach, this model? We know that there's been lots and lots of research done on Head Start and early Head Start, and this is just a sampling of some of the research findings, not an exhaustive review. But in general, we know that kids demonstrate growth in a variety of academic and early academic, pre-academic skills, reading, math, writing skills by the end of the program compared to their peers. We know that research has recently found, there's been research published just last year, I think, on intergenerational effects of Head Start, finding that the kids of Head Start graduates are likely to experience benefits as well, such as less likely to experience grade retention, more likely to finish high school and college, improved overall health. And there's more that they looked at in that study as well. Next slide, please. We know that the impacts go beyond the individual children that are participating in Head Start, right, to Head Start families. Research has found that families who participate in Head Start programs have higher rates of dental and health insurance coverage, because that's an important part of family well-being and part of kind of that community engagement and services for families. We know that they have a higher likelihood of graduating high school, completing post-secondary credits, and increasing their education levels. And we know that they're engaged in more positive parenting practices, are more likely to read more often to their kids, and are less likely to spank. Next slide, please. So today we're trying to kind of progress and think of, we for so long we've thought of Head Start as a program, right? As an individual program that operates over here. But what would happen if we instead thought about it as a model that could be replicated across childcare, across pre-K, across various other early care and education programs and systems, right? If every child who walked into an early care and education program, regardless of what funding stream or what state or what community, right, there was just a consistent level of quality that they could expect, a base level of quality with those different features that I reviewed earlier, right? Where there was a manageable ratio for teachers so children can get the individualized attention that they need, that all kids need at that young age. Where there's a research-based curriculum, where there's a bilingual staff if there are dual language learners, and all of these different pieces that really kind of attended to the well-being of the entire family unit. And that's what we're trying to imagine. How do we move toward, right, this universal concept of a high quality system for kids, where the overall health, well-being, and education of the child, of the family, are really the goal. And so today, a key mechanism for doing that, a specific funding stream for doing that, specific program for doing that, is the Early Head Start childcare partnerships. Next slide, please. So what are the EHS-CCPs? They were established back in 2014 to increase access to high quality care for infants and toddlers. It was increased access and increased quality really at the same time. And how do we do that? And we're going to dig into a little bit of how they came to be and kind of what inspired the partnerships during the panel discussion. We know that there are grants that fund early Head Start programs to partner with childcare providers, whether they're family childcare providers or center-based providers. Childcare providers agree to meet the Early Head Start standards and implement the Early Head Start model, and they receive the resources and supports needed to do that. We know that they've reached tens of thousands of kids. Here we have the 2021 number. And there's been about $1 billion allocated for EHS-CCP and expansion in the most recent budget. Next slide, please. So what can they actually buy? These grants that go to form these partnerships to meet these standards, what are childcare partners actually buying with these funds? And we like to take it down to a ground level so we can really fully understand how these work, right? So a lot of partners are purchasing or assisting their staff in attaining their entry-level credentials like the CDA or an equivalent state-level entry-level credential. There's training going on, there's coaching going on, including mental health consultation, support for the inclusion of kids with disabilities. There's a whole lot of professional development that's built into it. Some partners have increased wages for childcare partners. We know that there's been improvements in the physical environment where kids are playing and learning, including playground equipment, indoor toys, books, materials, other learning materials. We know, as I mentioned, that there's a big gap generally in state childcare licensing ratios and group sizes and what the early Head Start model is aligned with. And so funding has gone to do that, right? To lower group sizes, to decrease group sizes and ratios so that teachers have a smaller number of children at any one time. Curricula, assessment, screening instruments. So there's a whole kind of school readiness planning and implementation that happens. Family service workers, really to support families' individual needs and ensure that families, whatever support it is that they may need or goals they may have, that is being addressed. Next slide, please. And then there's the ripple effects that we don't talk about that often or often enough, but this funding, right, that goes to foster these partnerships between early Head Start and childcare to meet the standards. Some of this funding has the potential to benefit all of the kids in a classroom or all of the kids in a program beyond those who are directly enrolled, right? So if you do teacher training or coaching for all of the teachers, right, in a center, for example, that's not just going to benefit the individual kids enrolled, right, through the early Head Start childcare partnerships. That's going to benefit all of the kids who are in those classrooms, right, with those teachers or assistants. If you improve the playground, right, that's going to benefit all of the kids who go on that playground, not just those individual kids who are enrolled through the EHS-CCP. Similar type of thing, if you get a better curriculum, right, that's research-based or various things like that, right, that's going to affect all kids, right? Connections to the community. So if partners, early Head Start childcare, the childcare partners are forging partnerships with other community organizations to engage in those comprehensive services like screening, like social services, a variety of social services, health services, mental health services. Those connections, right, are established now and could be beneficial to all of the kids in the program. Next slide, please. So all of that is kind of the base and the foundation for why we published this set of briefs a couple months ago or a month ago, really looking at a few different dimensions of the partnerships. So we're going to go real quick through just a really high level overview of these briefs. And then webinars 2 and 3 will go much more in depth into the policy recommendations, the kind of research background and the interviews that we did with partnership grantees. So today, really high level brief overview, and then webinars 2 and 3 will really dig in a lot deeper. Next slide. So that first brief is really a set of high level recommendations, policy recommendations across Congress, across Department of Health and Human Services, and across states and communities for how to grow EHS-CCPs. Next slide. So of course, we kind of always start with this first one to authorize and increase funding for the partnerships. Number 2, really having HHS prioritize partnership applicants who serve the highest need and lowest resource communities. to really refund TA, technical assistance, support, guidance for not only partnership grantees, but for other folks who, other communities, community-based organizations, states, cities, others who are interested in establishing or growing partnerships outside of the federal grant program, right? I think there's a big need for how to do that, how to blend and braid and layer funds in general through the partnerships. And then really, we have spent a lot of time focusing on how states can and should, one, apply to be partnership grantees through the federal program, but also how they could spend their own funds, whether those are general state funds, whether those are leftover ARPA funds, whether that's CCDF kind of redirecting CCDF quality dollars moving forward, using all the new PDG funds on the street, right? And really how we can kind of redirect some of those to have this aligned vision for quality, right? Where we're kind of going toward the same model. And part of doing that requires us to bridge those quality standards across, the various systems and states, childcare, pre-K, Head Start programs. Next slide. The second brief really gets into the nitty-gritty of what states can do to build and grow and expand their own partnerships at that level. Next slide, please. So I won't go over all of these recommendations, but it really takes you through kind of step one is really thinking about your funding sources, your needs, what is the gap, right, between your childcare reimbursement rates, for example, and what it's costing on average to operate early Head Start in your state. What are the mechanisms through which you can get that money out? A lot of, state childcare administrators and agencies, have now have experience, a lot more experience with getting grants out the door through the stabilization grant process, right? And so how can we make use of some of the infrastructure that's been established over the course of the pandemic to really continue some of these grants and contracts, including through early Head Start childcare partnerships? Really thinking through a roadmap toward full alignment with the model, right? There is a lot of standards, right? And it's not easy. And so identifying those that are really critical to child health and family health and wellness and learning, and then building up to full implementation. Really thinking through the professional development infrastructure to enhance capacity and fair compensation. What does that look like? How can we use partnership grants from the state, right, to community to really think about those pieces? An important part of the formula is really funding a backbone agency to implement all of the comprehensive services and PD that go along with meeting the early Head Start model. Identifying an administrative home. I know BPC just recently came out with their new version of administration at the state level of early childhood systems. And really then thinking about aligning policies to facilitate program coordination and enable partnerships. And that is something that we've seen with existing early Head Start childcare partnership state grantees, really thinking through how we can kind of change policies, improve policies, align policies better to enable these partnerships. Next slide. I'm going to hand it now to my colleague, Eric, to go through the next few slides.
Thank you so much, Dr. Meek. The early Head Start childcare partnerships are resulting in real, tangible outcomes for infants, toddlers, their families, early childhood educators, and communities across the nation. I want to share a brief anecdote of my experience. Back when the childcare partnerships first came out, I had the pleasure of working at a local childcare provider organizing the infant and toddler services for our community, and we were the recipients of an EHS-CCP grant. And part of the funding itself was instrumental in helping us improve the quality of our services for children, but also to ensure that we could serve more children and families in low-income households through comprehensive services. So I remember very, very clearly and distinctly just how excited the teachers who were going to be in that classroom were about having funding to attain their child development associate and go to college coursework to help achieve that. They had access to training to better understand the Head Start program performance standards. They were empowered to support and select the new furniture and the materials, all in alignment with the Head Start program performance standards. So it had a direct impact on supporting our education staff who were working in that classroom. The other thing that was really critical was that the funding allowed us to increase their salary, their compensation, and their benefits in a way that our tuition revenue alone wouldn't allow us to do. And so those staff were able to benefit from a higher wage, as well as comprehensive medical, dental, and other benefits to support them as early childhood professionals. Now, the other unique benefit that we mentioned was the ripple effect. And so in the program that I worked in, not only did the classroom itself and the children and families and educators in that infant and toddler classroom have access to those resources, but also our entire program benefited. We were given access to professional development, so all of our staff, even if they weren't working in the Early Head Start Child Care Partnership classroom, they were able to participate in the coaching and training that was available to support their own pedagogical development. We had access to a completely renewed playground with new early learning materials that benefited children's engagement outdoors. And so those are just a few examples of how directly and what those tangible benefits are of Early Head Start Child Care Partnerships. But it's not just my story alone. We're seeing these impacts and these outcomes in EHS-CCP sites across the nation. In 2019, the Bipartisan Policy Center released a report where they interviewed 12 grantees to better understand the impacts and the lessons learned of the EHS-CCP model. What we found was that EHS-CCP sites, the funding boosted quality in many ways, like increasing credentials of the workforce, improving physical environments, and ensuring access to comprehensive services, mental, nutrition, educational, parent training, all the comprehensive services that come along with the Early Head Start model. Then again, just recently in 2022, we collaborated together, the Children's Equity Project, Bipartisan Policy Center, and Start Early, to revisit some of those grantees. So we highlighted 10 EHS-CCP grantees, including 2 state grantees. 5 of them were revisited from the 2019 report, and we had 5 new grantees as well. And we lifted up their challenges and successes operating during the pandemic. Next slide. And what we really noticed were 3 major themes or threads throughout the EHS-CCP grantees we talked with. One was their pandemic response and the ability to recover and have the resources they need to stabilize and stay in operation because of the Head Start model. Workforce support and comprehensive workforce and comprehensive services like mental health and healthcare access. And this isn't by happenstance. The EHS-CCP model centered on comprehensive services became a key mechanism to helping these local communities be resourced with the funding and the tools that they needed to stay open during the pandemic and continue to serve children and families. So we want to share just a few of the examples of how EHS-CCP have been able to support our communities throughout the pandemic. Next slide. So in terms of pandemic recovery and relief, we saw that the structure of the federal resources that were infused into local child care programs, that system, that method allowed child care programs to have a stable source of funding that then enabled them to keep their doors open for children and families in their communities. EHS-CCP grantees also were able to improve their facilities to meet health guidelines such as physical distancing. They improved airflow and added air filtration devices, and were able to access disinfecting supplies because of some of the additional federal funds that became available to Head Start programs. We also saw a significant investment in health and mental health staff consultation to support not only staff, but also families and children as they address. And next slide. In terms of the workforce support, one of the major themes we found among EHS-CCP is that they were able to invest in recruiting and retaining a qualified early care education workforce and maintain many of their Early Head Start Child Care Partnership staff to continue to provide that consistent, reliable care for young children. Areas to note, across the grantees that we spoke with, altogether they supported more than 570 teaching staff to work towards or achieve a CDA, so investing in their professional development as well as their access to college credits. And then we saw a pretty consistent increase in staff wages, many times above and beyond what was allowed through some of the, or what was provided through some of the federal relief dollars. Next slide. Because of the comprehensive services that are sort of central to the EHS-CCP model, we began to see a significant investment in those mental health services to support the holistic development of child, family, and of educators. Several of the grantees in our report prioritize those resources, both for enrolled staff and parents, as well as those who are not enrolled in the program. So for example, some providers invested in mental health consultants, both for their staff as well as for families to have weekly or monthly calls, professional development, training, and tools to support their mental health during the pandemic. And then we also saw an increase in the connection between staff and parents and community resources based on their individual mental health and health needs. So before I turn it back over to Dr. Meek, we just want to point out that, of course, check out the briefs at the Children's Equity Project website to learn more about the impacts directly in communities through EHS-CCP grantees. But we know that states are uniquely positioned to advance models that improve quality services for infants and toddlers. Early Head Start Child Care partnerships serve as a key mechanism to infuse federal resources into local communities, maximize the strengths that exist between local child care programs and the Head Start model, and address some of the most significant challenges the early care and education field faces today, including recovery from the pandemic, retaining a qualified early childhood workforce, and expanding access to comprehensive services for children, for families, and for educators. Back to you, Chantal.
Thanks, Dr. Boucher. Can you go to the next slide, please? So now we are going to have a conversation and switch over to the panel discussion. We can actually exit out of the slides altogether just so we can see faces a little bit bigger here. Great. So I'm so thrilled to welcome you, Yvette and Linda, for a discussion on the partnerships. Thanks again for your partnership on this. Why don't we start at the beginning? So the three of us were working together in the Obama administration and federal government when the EHS-CCPs were first being, thought up, designed, developed. So let's start there. Can you, maybe Linda, you can jump in first, and then Yvette can tell us about the vision, the original vision, and the original kind of origin story for the partnerships. What propelled them forward?
Yeah, well, thank you, Chantal, and thank you for the briefing. It was excellent. And I would encourage our audience to go look at these briefs because there's a lot of information in them. I think the first thing that I would say on this one is there had been, and Yvette, might be able to shed a little bit more light on, there'd been some conversations around the partnerships prior to the work that we did. But there had been nothing around funding or the model that we developed as a result of the funding that we got from Congress. But the original idea, if you recall back to the Obama days, there was a lot of interest and emphasis around the country on pre-K. And that included Head Start for 3- and 4-year-olds. And we were always concerned that we were leaving out a large part of the infant toddler population in the country. So in an effort to try to think through how do we get some funding in that would support infants and toddlers and do that in a way that would be using, what we had available, and that was through the childcare system and these partnerships. So we actually gave a lot of thought to then how do we fund it? And I think, the early days were just how did we look at getting money into childcare so that we could develop these partnerships. And I think that took a fair amount on the part of all of the staff in terms of thinking through how we could blend these programs. But I would kick it over to Yvette, because I think, Yvette, you were there in terms of anything that happened prior in terms of the partnerships, and then you saw it evolve through this process.
Yeah. Hi, everyone. Thanks, Chantal, for putting this all together, and grateful to Linda for her partnership on this as well. I would ditto everything that Linda said. I would also, though, mention Shannon Rudisell, who was the director for the Office of Child Care at the time. And Linda's absolutely right. I think that for a while, really even before the Obama administration, had been thinking about how to serve infants and toddlers. And so you covered a little bit of that history going back to early Head Start. And I think with just sort of the timing of where we were at and who was there, with everybody's expertise around childcare and Head Start, it was really a good time to think about how you raise quality across the board, but also how you bring more kids and providers into a system in order to support the workforce and provide quality programming for kids and families. So I would almost say it was a little bit of a leap of faith, and we all had to take a little bit of a risk to see how it was going to go. I don't think anybody really knew, but we knew that we had to do something different. And we've always known that Head Start dollars were really a base or a foundation for a lot of funding in communities. And now it was really time to think about how to use that funding beyond Head Start to support other providers across the field. And from where we were sitting at the time, from a federal perspective, it made sense to think about CCDBG and Head Start together. And I think it's worked out beautifully. It's had its ups and downs, just like other early childhood programs do, but overall, I think that we've seen some really positive results from it. And especially just go back to where Eric mentioned the ripple effect. So we really see that amplify itself out for more kids and families getting those high quality services of, teachers who hopefully are better paid, family service workers who are really helping to think about a whole family approach, and then just really thinking about the services that brings for kids and families and communities, which was always the point of Head Start, right? Community-based.
And Yvette, adding to that, I think I used to say at the time, Head Start has always been the nation's laboratory for how do we do things? How do we develop different things? And I think the partnerships just took that to another level. I mean, it was, as you said, a big leap of faith, but we had a lot of commitment from people and a lot of support. And I think, and we've learned it was a laboratory. And it's proven to be, a good model, to Chantel's earlier point.
So Linda, you didn't share this story, but I remember you always sharing the story before when we were developing them as part of what motivated kind of kickstarted some of the thinking at the time. I remember you shared with us that you once walked in, this is not a unique experience, but that you walked into a single building, right? There was the Head Start classroom, and then there was the childcare classroom, and the Head Start classroom was all engaging. They had all the materials they needed. The, teachers were engaging with the kids, and, it was exactly what you want to see when you go into an infant toddler classroom. And that you went literally next door under the same roof in the same building, right? And it was just a completely different experience, right? There was kind of like this plastic bucket in the middle of a room with some like light up toys and some random stuff in there, and just a lot less going on in terms of engagement and learning and responsiveness and just resources. There's just a stark difference in resources. And so I think that points to like the underpinning and like the reason for all of this, right? Like we don't want that to ever be the case, right? All kids should be able to walk in whatever door they're going to walk in, and there should be a consistent level of quality that's expected. And so I think I wanted to share that story because I think it really brings it into stark focus, the why.
And I still tell that story quite frequently, actually, because it was real. And I can still see those two rooms with kids getting such a different experience, and children on both ends of that building really, qualifying for either CCDBG subsidies or Head Start. I mean, in both cases, these children really needed it. And it was a motivator to get a lot of stuff done. I think, we touched on something else here that I think you kind of said a little bit about, and Chantel, and that is this idea that we can integrate children into classrooms. We don't need to have, separate classrooms like was in that facility. In many cases, you can get and we showed this in the partnerships, where a classroom can be some childcare kids and some early Head Start kids, and they're all in the same classroom and they're all learning from each other, that integrated model that I think the research supports. But too often we have these things separate.
Yeah, I would just add, because I also see some comments, right, that Head Start and early standalone Head Start and early Head Start programs have been doing some of this work for quite some time. And that is true. But what I would say is that the early Head Start childcare partnerships did a couple of things. One is, I think it gave permission to Head Start programs to intentionally think about how to layer funding. If you were taking childcare funding or you were taking other state funding to fund your program, you could now actually think about how to layer that funding. And it's not that programs could never do that. It's just that this time we were very intentional about saying this is okay. And then there was this additional funding to support this very specific model. And the other thing I think this also did is that we had heard from Head Start programs about why they didn't want to layer state funding with federal Head Start funding. And we took a lot of those things and put it into the training and technical assistance, right? So I think specifically around cost allocation, which is really hard to do. And we tried to get really like in the nitty gritty of how do you cost allocate so that you are in compliance with federal and state and local rules. But then on top of that, I think we also turned to models that had already existed, right? Like migrant and seasonal Head Start and tribal American Indian Alaska Native programs that had also been running similar models because their funding was lower than our regular Head Start and early Head Start, and really pushed out like all of these supports and resources so that the partnerships would be able to stand up and be sustainable. I should also mention we were at the beginning of designation renewal, right? Recompetition. And we heard a lot of pushback around implementing the partnerships because programs were very concerned about whether their childcare partners would be able to rise to the occasion. And so we really talked through that and provided the technical assistance. So I think we were really much more intentional and we listened to what programs told us about what they were going to need. And also like all these decades of learning from other programs who had tried to do this, and maybe there weren't the intentional supports that existed then, and I think continue to get better even now.
I think, when it came to the resources, I don't think we can underestimate the impact those resources had. I remember in the early days going around and looking, because the amount of equipment, just basic equipment, supplies that were purchased for childcare programs with Head Start funds, redoing playgrounds. I mean, we did a lot of work on kids' playgrounds and play environments. But I want to footnote one thing that I think, prior to the partnerships, what I saw happening between CCDF and Head Start was Head Start would have its day and then it would look for CCDF to do the before and after. And it wasn't really layering as Yvette described. It was really doing the wraparound services. And I think this took that in a new direction. Instead of it being, sort of wraparound, we actually put the money into the program so that each eligible child was roughly getting about twice, the childcare program was getting roughly twice as much for that one child, which bought the supplies and the equipment and the training and all the rest. And I think, when Chantel talks about why this is a model, this is, I think, at the core of this program, why it can serve as something for this country to pay attention to.
Yeah, and then I'm like just going through the Q&A. There is another question raised around opening this up to states. So I just want to clarify that the recommendation is that more states consider applying to be grantees of the partnerships. And I just also want to mention that this is actually allowable. states can apply to be early Head Start Child Care Partnership grantees. These are all rules that were put in place and that the Office of Head Start does implement. So again, like, we're not saying opening it up, it's a recommendation that states should consider this. And again, would encourage folks to take a look at those reports, because the recommendation clearly talks about how when a state is a grantee and they're getting the federal funds and they're required to implement the Head Start program performance standards, it really then forces states to think about the alignment of all of the money that is going into early care and education programs at the community level within those states. So we've seen evidence of this. We saw in the first wave of awards that were made, several states did actually become Head Start grantees. And so there is accountability there for when a state becomes a grantee about how the funds are used and how they're layered with other funding in order to make sure that you're providing those comprehensive services at the community level.
Yeah, and I just think to underline that, right? Like, it is about alignment to the Head Start model, right? It's about getting the Head Start model out there to as many kids as possible. And the truth of the matter is, right, states have a huge stake in early care and education systems with childcare and with pre-K, right? And so thinking again as Head Start, not just expanding the program, which we are all for as well, but thinking about replicating the model and alignment to that Head Start model is, I think, part of the backing and inspiration for the partnerships. So let me switch a little bit here to talk about some of the grantees we interviewed. So Linda, you and I both interviewed several grantees for one of these briefs like 5 years ago, back before I had kids, which seems like a different lifetime. But we went back and we talked to a lot of the same folks who we talked to back then recently, again, during whatever the pandemic. Talk to me a little bit about what you heard from folks and what stood out to you in those interviews this time around.
Well, I think what stood out, and I listened in on all the ones that we did, and I was just taken aback by the positivity of it all. I think that in talking to the grantees that we talked to, I didn't hear anything negative about that, about the partnerships. And in fact, in one interview, it was said that they wished they had applied for more because of the, how they had gone. I think that the several things stood out, and especially during COVID, and that was we actually heard in many cases that these grants kept childcare alive in the interim before we were able to do something more from Congress to get money out to childcare programs. The grant money through the partnerships kept them open, which I think our country owes some people a big thank you for that, because there were really critical times not too long ago. We heard a lot about what we're talking about was the collateral, impact. And I think we can't underestimate or overestimate, I should say, the importance of these ancillary services. So the mental health, we heard that everywhere, where the mental health pieces, the supports for providers, for families, was just so important during COVID that you just can't overestimate how important that was. And I think the other services that were kept going. And the other thing we heard is that they were the vehicle to get, health materials into childcare programs in the very early days. So, I mean, we never heard anything negative, and we did hear, I think that people wished that they had more. There was never a question about people wanting less.
Yvette, I know a lot of the EduCare providers are also partnership grantees. I don't know if you want to highlight any of the stories there or different pieces during the pandemic from there.
Yeah, I mean, I would just share that, what we've learned from the educare schools that are partnership grantees, but they are usually also Head Start standalone Head Start grantees and early Head Start grantees. So they have a lot of Head Start funding, is really the ability to use all of these funds, including state funding, to be able to expand, for example, mental health supports that families really needed during the pandemic, right? So really being able to easily pivot in order to support whatever was happening for families at the time. And so I think that that's a really important piece, because as we're all thinking about how to support families in the way that works for them, one of the things that we've heard from our schools, who a few are highlighted in the report, is that ability to have some flexibility and to be able to pivot quickly and to be able to use these funds to serve families in the way that that helps them. And we heard a lot of that came through mental health, but we also heard a lot of it going towards bonuses and other supports for teachers and other staff at programs, including supports for like family childcare providers, if those were part of your early Head Start childcare partnership model, right? Like making sure that family childcare providers were able to stay open as safely as possible, but also making sure that they got the supports that they needed to be able to keep their homes healthy and safe for kids and families that they were serving.
So, Yvette, you previously served as a director of the Office of Head Start, and before that, the National Migrant Seasonal Head Start Association. So I see some comments in the chat too as we're going about kind of the unsureness of the state role here and states really aligning to the model. So talk to us a little bit about how you think the partnerships fit into the future of Head Start and what that looks like.
Yeah, I mean, so from my perspective, obviously, like when we implemented it in the Obama administration, we had a lot of questions, but as we all shared previously, right, it was a risk at the time, but we knew we had to try something to make sure that we were serving families and communities in the continuum, right, of prenatal to school entry. And this was one way of making sure that care for infants and toddlers and their families was prioritized. The state, because I see I'm watching the comments too, the state question is always coming up, and there is always a fear of that. And I think what the partnerships has shown us is that states can be grantees, and what happens is it does force states to rethink how they're aligning funding and aligning policies and regulations, which is in the report, so that it can make things easier for providers at the local level, but especially make it easier for families to access the services. So I want to be clear, I'm not saying Head Start should be block granted, but what I'm saying is that we have evidence that states will do what they need to do for kids and families. I will also say, like, as you know, Head Start is still federal to local. So it was still federal to local, right? The relationship was with the state. So whatever that state was, whether it was the Department of Education or the Department of Health and Human Services or the Department of Early Childhood, whoever was the grantee, they had the same relationship that regions and the national office had with grantees on the ground, right? So that didn't change, neither did the monitoring or any of the expectations. So the state was still expected to comply with the Head Start performance standards, and they were still monitored the same way. And just like other grantees, they had the ability to come up with a locally designed option, right? But it all had to be within the parameters of the Head Start performance standards. And so I think if you look at states like Alabama and Georgia in particular, you'll see that there is this huge alignment across funding, and you can see what the system looked like before the partnerships and then what the system looks like after the partnerships in those particular states and the other states that I mentioned that are also grantees. So I would say that it is a model, and we have in place the mechanism and the supports to make sure that it continues to be federal to local, and we're doing what's right for kids and families on the ground.
You know, can I jump in here? I want to add something, because I think one of the biggest things that we learned out of the partnerships. I think there was a lot of what I would say myth busting going on, because you know, there were a lot of concerns about the standards and they couldn't be implemented, etc. And I think what we found out, and Yvette, maybe you remember this differently than I do, but I don't remember being presented with a problem that we could not solve in terms of the alignment of the two, you know, so that these things could work together, so that the standards, I think where the myths are around the Head Start standards as much as anything, in that they're actually, you know, not, I mean, they're solid and there's no question about that, but it's not that difficult to align state standards with them. And I think that's one of the things that some of the states learned, is that once they finally had to really sit down and read the standards weren't all that different and they could make it work. So I think that was a big lesson for people. You know, the other thing I think that I see it in the chat as well about the 3 and 4 year olds issue. You know, I think, what is it, 46 states now have some kind of pre-K. And we really do need to think about, we said even in the days we were there, that grantees needed to think about early Head Start and serving more infants and toddlers, because that's where we have just a crisis in this country, is the lack of infant toddler childcare. And so if these partnerships can do anything to, you know, to expand and promote that, we need to do it.
Yeah, absolutely. So let's talk about the childcare side of the house a little bit more, Linda. So in your role in the federal government office, obviously you were the Deputy Assistant Secretary for Early Childhood, and OHS and OCC were there under your leadership. But before that, you also served as the CEO of NACRA at the time, now Childcare Aware. Talk to us about how the partnerships have the potential to be game changers, really, for the childcare system. I left a whole lot out of your bio with like starting in childcare as a director and a teacher and DOD and all that, but you know, you get the idea.
Well, I think what they are, and I thought this at the time, and I still do, is they are a model for how we get money into childcare programs to sustain them. And I think we learned during the COVID experience that the childcare funding is so fragile in this country. And if you remember, this is true of the Head Start versus the childcare. Head Start grants, they kept their grants. They didn't lose their program. They didn't lose their staff. They could still pay their staff. They had their grants. Childcare, on the other hand, when things started to close down, had nothing, folks, because their income was dependent on parent fees and or childcare vouchers, which went away. Now, a number of states picked those up very quickly, but the instability of the funding in childcare is, I think, the single biggest issue confronting us now. And the partnerships showed that if the money goes into these programs through the providers will in turn provide the quality of care that we want them to. But they can't do that unless they have reliable funding. And the partnerships, as I said earlier, essentially doubled the amount of money a provider got for a child and gave her the stable funding. I saw in the chat that there was a question, are these annual? The grants, the Early Head Start Childcare Partnership grants are 5-year grants, but they're always 1 year contingent on funding, blah, blah, blah. So the money is there for 5 years once the agency gets the grant. And that stability, even if it's a year contract with a partnership organization, gives that provider guaranteed income to pay people better, to buy equipment, to buy supplies, etc. And I think as the models going back to my own history, both with the military, which is sort of what we did there, was give money to the programs to buy, to pay for the quality we wanted to see. The Early Head Start childcare partnerships do exactly the same thing by putting money into programs.
Let's turn to federal agencies where we used to work, where you all used to work. So the omnibus bill, that was just signed by the president included about a little bit less or about $1 billion for the partnerships and the EHS expansion, which is the biggest funding allocation we've gotten yet, right? You both served in leadership positions during the Obama administration at HHS when these were getting up and going. What should the department and the Biden administration more broadly be doing to further advance the EHS-CCPs?
I mean, right off the bat, I would say that they should just continue to encourage them. I mean, I think one of the things that we found early was the more that we went out and said, yes, this is a positive thing, let's do it. If you're having concerns or challenges, like reach out. So I would just really sort of encourage folks at ACF to continue to put the partnerships forward as an option for Head Start grantees and childcare partners to get in there with. There might be some things along the way that could be considered as they think about regulations, but I think that's all sort of down the road. So for now, I would say, the more that we can demonstrate that this is a really important option for states and communities, and that means that more people going, that there's more interest than there is money, then that's always a positive thing.
And I think, Chantel, from where we sit, we continue to put forward our support every year for the partnerships, and feel very strongly that they are, doing the right thing and moving the country in the right direction for all the lessons learned. And before we get off, I made a note to myself to remind myself to give a shout out to the original grantees in particular, who came in. We had grants in every one of the 50 states during that first go around. We put out $500 million in grants that year. And, it gets back to applauding the people who took that leap of faith with us. And we learned a lot. And we know, we know that there were challenges, and I think we need to recognize those challenges. And when I talk to members of Congress, I don't deny that. They are hard. Partnerships are hard, collaborations are hard, but we're not doing this for ourselves. We're doing this for children and families and some of the most vulnerable in our country. And I would put that out there to people to remember that at the end of the day. Chantel, you'll remember me saying this. I still have my little keychain with my little person on it that I used to say every day. I get in the car and I look at that thing and remind myself of a child. We've got to stop thinking of we've got to start focusing on the children at the end of the story here, or at the beginning, really. And that's what matters.
I think that's a perfect place to wrap us up. Thank you so much for joining me in this conversation, Linda and Yvette. Thank you, Eric, for kicking us off at the beginning. And thank you, everyone who joined us. This is just part 1 of a 3-part series. So we're going to have part 2 is April 4th. Thank you, Janiqua. And part 3 is set up for July 18th, where we'll dig much deeper into the reports that we gave you a high-level overview of, and have some more interesting discussion, including with some folks who are actually operating early Head Start childcare partnerships at both the state and the local levels. So again, thank you so much for joining us. I hope you can join us for parts 2 and 3. Look out in your email and on social media to sign up and join more. So thanks so much. Have a great day. Goodbye.